Acupuncture and rheumatism, how to use acupuncture to treat rheumatism under TCM. Acupuncture, a key component of traditional Chinese medicine, TCM, can be an effective treatment for rheumatism, which is often characterized by chronic joint pain, inflammation, and stiffness. Here's a detailed explanation of how acupuncture is used to treat rheumatism under TCM. Understanding rheumatism in TCM. In TCM, rheumatism is often attributed to an imbalance of qi, vital energy, blood, and the invasion of pathogenic factors such as wind, cold, and dampness. These factors can lead to blockages and stagnation in the meridians, energy pathways, causing pain and discomfort in the joints and muscles. Goals of acupuncture for rheumatism. 1. Relieve pain. Acupuncture helps to stimulate the release of endorphins and other neurochemicals that alleviate pain. 2. Reduce inflammation. By improving blood circulation and reducing stagnation, acupuncture can help decrease inflammation in the affected areas. 3. Restore balance. Acupuncture aims to balance yin and yang and ensure the smooth flow of qi and blood throughout the body. 4. Enhance mobility. By relieving pain and inflammation, acupuncture can improve joint mobility and overall physical function. Acupuncture techniques for treating rheumatism. 1. Point selection. The choice of acupuncture points is tailored to the individual symptoms and underlying TCM diagnosis. Commonly used points for rheumatism include local points, directly around the affected joints to relieve pain and inflammation, example ST35 for knee pain, Li15 for shoulder pain. Distal points, located on the same meridian but away from the affected area to help balance the body's energy, example Li4, Li11 for general pain relief. Systemic points, to enhance overall energy flow and strengthen the body's resistance to pathogenic factors, example ST36, SP6. 2. Needling techniques, tonification, Buletin, to strengthen and support the body's qi and blood, especially if there is a deficiency. Sedation, Xian, to disperse excess or stagnation, particularly if there is severe pain or inflammation. Even technique, a balanced approach for general conditions where neither tonification nor sedation is predominantly required. 3. Adjunct therapies, electroacupuncture, mild electrical currents are applied through the needles to enhance the therapeutic effects, particularly effective for chronic pain. Moxibustion, burning moxa, dried mugwort, near or on the acupuncture points to warm the meridians and dispel cold and dampness. Cupping, suction cups placed on the skin to improve circulation and relieve muscle tension. Treatment process. 1. Initial consultation, comprehensive assessment of the patient's medical history, symptoms, and overall health. Diagnosis based on TCM principles, including pulse and tongue examination. 2. Developing a treatment plan, individualized plan outlining the acupuncture points, techniques, and frequency of sessions. May also include dietary and lifestyle recommendations to support treatment. 3. Acupuncture sessions. Typically, a course of treatment involves multiple sessions over several weeks. Each session lasts about 30 to 60 minutes, during which needles are inserted and manipulated according to the treatment plan. Patient comfort and relaxation are essential, with adjustments made as needed based on feedback. 4. Monitoring and adjustments, regular evaluation of the patient's response to treatment. Adjustments to the acupuncture points and techniques based on progress and any new symptoms. Expected outcomes and benefits. 1. Pain relief. Most patients experience significant pain reduction after several sessions. 2. Reduced inflammation, decreased swelling and redness in the affected joints. 3. Improved mobility, enhanced joint function and range of motion. 4. Overall well-being. Many patients report improved energy levels and a sense of well-being. Considerations and precautions. Qualified practitioner, ensure the acupuncture is performed by a licensed and experienced TCM practitioner. Regular sessions, consistency is key, regular sessions are often necessary to achieve and maintain results. Complementary care, acupuncture can be combined with other treatments such as herbal medicine, physical therapy, and conventional medical treatments. Patient education, patients should be informed about what to expect, potential side effects, example minor bruising or soreness at needle sites, and the importance of following the treatment plan. In conclusion, acupuncture is a valuable modality in TCM for treating rheumatism, focusing on restoring balance and alleviating symptoms through targeted point selection and holistic care. By addressing the root causes and symptoms of rheumatism, acupuncture can significantly improve the quality of life for those suffering from this chronic condition.